Hey guys, thank you for tuning in. It's Brandon, the therapist, and I'm here to give you the best information on male infertility and how to grow from it. So, guys, today we're going to talk about things to talk to your urologist about. The problem is we go in unfamiliar with infertility and we don't know much about it other than the fact that we can't produce babies. There's no causes, we don't know what questions to ask. We just really go on the doctor's advice. If you go on a doctor's advice, the doctor I seen told me that I just wasn't producing. I mean, there were sperm fragments, but there were no whole sperm. But in his diagnosis, I wasn't producing, and we kind of left it at that. But there was no reason why or cause. And at the time, I didn't know what questions to ask. So I'm going to talk to you guys about a few things that can cause male infertility and why it is important to ask your doctor about it. The first thing we have is varicose. And this is when the veins in the scrotum are swollen, the blood flow drainage is being blocked somehow. And thus, it's causing your testicles to lose homeostasis. So that temperature that they're supposed to be in at all the time, they're not. They're probably overheating. And if they're overheating, then it will cause a problem in sperm production. Because of the difficulty with sperm production, it will also make it difficult to get pregnant. Not impossible, but very difficult, and this is also correctable with surgery. The next question to ask is, what about retrograde ejaculation? This one is a weird one. And this is weird because the sperm goes inside your bladder versus out of your penis. So in a sense, you're having dry ejaculations. And do I really have to explain why it's obvious that this one would cause some sort of difficulty getting pregnant? So it's definitely a question to talk to your doctor about. The next one is called Immunologic Infertility. Ask your doctor about this because you could have antibodies attacking the sperm, and all of a sudden you can't get the child that you want because your body's attacking your sperm. And what is the cause of this? As of current research, the cause is unknown. However, it's still worth talking to your doctor about and exploring the possibility of this actually happening and seeing if there's some type of solution. Another question to ask is, what about obstructions? Obstruction is when there's just a blockage in one of the tubes and the sperm isn't being released. And if the sperm's not being released, then again, we understand why there will be trouble in having a child. Make sure that you ask about any obstructions that will cause you to have trouble having children. The next thing to consider is hormones. Is one of the things to ask about, and ask if your hormones are balanced. Simply, if your hormones are out of whack, your sperm count may be out of whack also. This is definitely worth exploring with a doctor, and also a great way to make sure where you are on the testosterone scale. Is it too high, too low? Where do you fall in? So I would say recommend getting a T-test. You also have chromosomes. Chromosome deletion and things can happen over time. I am unsure this cause. This is not my area of expertise, but it's a good question to ask a doctor. They do have genetic testing and they are capable of testing to see if there's been any chromosome deletions. Next, we have medication. Is there a medication that caused the infertility? Medications over time can disrupt the body in certain ways. And so while we're healing, we could be disrupting something else. So is it a medication that has caused low sperm count or has affected the sperm negatively in some way? The next thing you can ask about is genetic disorders. Is there Klinefelter's disease? Y chromosome microdeletion, Noonan syndrome, or chromosomal translation problem? Talk to your doctor about these issues because they can possibly be the reason why you're struggling to have a child. And if these are some of the reasons that you're struggling to have a child, then you'll be able to come up with you and the doctor will be able to come up with a solution, and it will give you an answer, or at least you ask every possible question that you've known to ask. Guys, I'm not your doctor. My medical expertise relies in mental health. Make sure you consult with your doctor about anything that I've mentioned, and do not self-diagnose. These are just tips on what to ask the doctor. Guys, thank you for joining me. Again, I'm Brandon the Therapist. Follow me on Instagram at brandon.therapist. Also, don't forget YouTube at brandon.therapist. Again, I'm here to give you the best advice on male infertility. Can't wait to see you again. Talk to you guys next time.